Hi, my name is Jessica Guller, and I'm excited to speak with you today at the AOCA Media Seminar on negotiations, having a seat at the table, and leadership roles. I have no disclosures to share. I would like to give the caveat for the reason why this is a topic that I would like to share my experiences in order to give you some ideas for your own negotiations, especially as you have career changes and you are navigating some of the difficult negotiation situations that you can be in, but specific to the field of anesthesiology. I'm currently Division Chief and Vice Chair of Pediatric Anesthesia at Children's Nebraska and University of Nebraska Medical Center. I'm the chair of our practice plan at Children's Specialty Physicians, and I have been engaged with and successfully negotiated our compensation and other types of benefits and support that we have needed. So between that and the lessons learned that I implemented from earning my Master of Business Administration, of which one of my favorite classes was negotiations, I would like to give you an idea of the strategies that you can employ for the betterment of your own negotiations. I'm going to describe the art of skillful negotiation in brief as an overview. We will discuss strategies for negotiating for a positive outcome, especially during a career transition. We'll look at the considerations for anesthesiologists in the current market, of which there are many, and we are in an evolving market that I know all of us are experiencing similar challenges and benefits. But when armed with the right information, we can have the success that we need in order to advocate for the best conditions for us. I'd like to explain through examples how to implement strategies in practice. The majority of us have not received education in negotiations, communication strategies, and how to navigate those difficult conversations beyond breaking news within our field with those we intersect with on a daily basis. And often we can have communication styles that, despite good intentions, result in the opposite response, and we are confounded by highly trained professionals, yet we're still needing some optimizations of these critical interpersonal skills to demonstrate and advocate for the terms and the conditions that we not only deserve, but in order to advocate appropriately for not only ourselves, but the others that we work with. When you are thinking about negotiating, and I'm going to use compensation as an example, whether it's a new job or whether it's an existing job that requires a compensation adjustment, especially given the staffing shortages that all of us are facing, preparing for this negotiation cannot be understated. We're going to go over different negotiation strategies, identify and plan for a best alternative to a negotiation agreement, and consider weighing negotiation options. Here are some different books that I found to have a lot of different great ideas, including strategies that you, with your own leadership or communication style, can employ by having the right framework in order to ask the right questions to get the right answers. The one that I think has been most influential in my own career has been Never Split the Difference by Chris Voss. He is a hostage negotiations expert, and there are many different strategies that he, and then following his completion of hostage negotiations for over 20 years, his group have been able to employ very successfully. And it comes down to being able to ask questions in the right manner, to be able to have the right attitude, and to be able to turn the tides on the person that you're negotiating with without them feeling like you are trying to take advantage of a situation. And even when you're intersecting with people in business, we know that their obligations, responsibilities, and motivations sometimes are counter to the fair and emotionally driven outcomes that we often are seeking, even with excellent justification. This particular book and these strategies actually apply to many different areas of your life, including intersecting with surgeons and patients and families and colleagues of varying and diverse personalities and approaches. And I have employed these techniques myself and been able to overcome obstacles that others have tried without success to engage with. So I highly recommend. There's actually a whole bunch of YouTube videos on this too. There are many different career transitions in anesthesiology. And so depending on where you are at in your career, after training, navigating discussions for your first job to ensure that you are able to receive the best terms for your first job, having the ability to negotiate is very, very important. My own strategies historically included discussing what types of questions I need to ask, what types of framework and questions I needed to understand in order to ask the right questions from those later in careers and who had worked in different types of practices, from private practice to outpatient surgery centers to academic to combination. And that honestly was surprising to some of the places that I interviewed. They're often asked, how did you know to even ask that question? And having the right questions and knowing how to respond to some of the ways they strategize to ensure they have the best deal really was very helpful. You could be changing the type of employment location, the type of practice model, or even the type of facility that you're working in. You could be looking at a combination of clinical and administrative employment. Personally, one of the goals as I have evolved in my own career that has come into fruition that I find to be balancing is to have a combination of a clinical and administrative role where I'm able to utilize leadership positions to be a great advocate and leader, while balancing that with having a robust amount of clinical practice as well, which not only is fulfilling, but it also allows others that you lead to feel like you truly understand what they're going through. But honestly, we trained to do this because we really, truly enjoy the clinical aspect of it. But being able to have a parallel of both of those different types really has been fulfilling for me. And so we will discuss some of that. There are the switches between private practice models and academia, or a hybrid. And that's the type of situation that I'm in, is more of a academic/hybrid model. And then the different staffing models require certain questions too. We won't go deeply into that, but being able to understand the ways to ask for certain types of parameters for your compensation, depending on the staffing model that you have, is another facet to consider. Now, anesthesiologists negotiate on a daily basis. We disclose events, we deliver bad news, we have to delay and reschedule cases if the patient isn't optimized or ready for anesthesia. We have to negotiate with non-medical leadership or resolve conflict with a colleague. I have yet to meet anyone in a group that doesn't have some type of opportunity to learn from yourself and the way that you converse and navigate the diverse personalities with which we work, from colleagues to other staff that we have work with. And so there are many different ways we have been exposed to this. And so this isn't a skill that's fresh for us. It's really just needs to be honed in order to be able to have success for those really meaningful aspects of our contracts and especially our compensation. Now, when you are wanting to negotiate and you have a set date, let's say you are looking at updating compensation. And I know I'm focusing a lot on this, but really this is the hot topic that people are discussing, especially in the last couple of years and especially post-pandemic, because the conditions in the anesthesia market have changed. And we're going to go over what it looks like, really the picture over the next less than a decade now and what has been projected. But the importance of preparation, this is creating a list of the types of things that you're going to discuss and putting them in categories. There is specific approaches you want to take, and even practicing with somebody else so that you feel confident that you're able to pause and answer questions that you can anticipate, but even if you can't anticipate being able to answer, how to defer those questions until you have a response you're comfortable with. There are also different ethical approaches to negotiating. There are tactics for difficult negotiations, and learning to recognize and combat those hardball negotiation tactics. And that book I described to you earlier, Never Split the Difference, is really helpful. One of the things that was actually difficult for me to digest when I first learned about it is fairness has no place in negotiations. Now, we as physicians, but also as human beings, we really desire and wish that that fairness would be considered, or hard work would be rewarded as at a baseline. But with competing interests and administrations that are balancing their own revenue and balance sheet and the different pressures they're facing, we all know that you can work as hard as you want, but if you don't ask for it, it's not going to happen. And if you start discussing what should be fair, or even using that word, which can be a trigger word, it actually is not helpful and can put the trajectory or even successful course of your discussion, it can bring it to a halt. So looking more objectively and avoiding trying to focus on fairness really is a critical aspect. When you approach a negotiation, you need to start with an open mind. You want to be able to listen to the other person's offers, points of view, and try to avoid making assumptions or judgments before hearing them out. A lot of times, and especially in the beautiful American culture, we interrupt, we anticipate what answers will be, we assume that our interpretation of a situation is the truth, and we learn through experience that pausing, listening, and letting the entire discussion from the other side come out really can change the course of a successful discussion. Once you establish common ground, you want to look for areas of agreement or shared values that serve as a foundation for your negotiation conversation. We're going to go over this further. This can establish a sense of trust and make it easier to find solutions. As I was discussing compensation review last year, I was discussing the operations aspect of how we as anesthesiologists are critical to the operations of surgical services, perioperative services, especially given that in most hospitals, surgical services and the procedural aspect really generates about 60% of the revenue that an enterprise is able to receive. Because of that, mutual benefit comes from recruitment and retention and potentially even retirement of people within the institution, knowing that recruiting a new physician, the estimates are costs about $200,000 each person, and the lack of adequate staffing has 7 figures of impact on revenue generation for an institution. So approaching with a common ground where knowing that not having adequate staffing or attrition would lead to reduced operations, this particular lens was very successful in discussing with our chief financial officer that we have the same goal, we have the same outcome, and that is to ensure that we can staff all of the anesthetizing locations that proceduralists and surgeons need to use in order to schedule and complete cases, and reducing anesthetizing locations due to barriers in staffing or attrition leads to not achieving that mutual goal of serving as many people within that enterprise as possible. Use active listening. Listen carefully to the other person's perspective and try to understand their point of view. And then that active listening requires techniques such as paraphrasing, summarizing, and asking clarifying questions. We'll talk about that too. Acknowledge emotions, but do not focus on them. It is important to ensure that you remain as objective as possible while appealing to the fact that patient care and safe patient care is our number one priority. And know when to take a break. If the conversation becomes heated or emotional, it may be necessary to take a break and return at a later date when everyone is more calm and focused. Now, in negotiations, there is a clock face model, and on your slides, you should be able to zoom in on this clock face. The types of negotiations that are detailed here have increasing levels of trust. On the right side is a competitive, price-focused, that is also arrogant and inflexible. It has value distribution. It has a lot of win-lose scenarios. But when you look on the left side, it's more collaborative, multivariable, low conflict, and creative scenarios. It's value creation, win-win scenarios. Let's divide the pie, but expand it to make it bigger. This ends up being more successful than the right side of this clock, especially in medicine. What is negotiation? Negotiation is silence, listening, asking questions, telling, being in control with the time, the process, the body language, speech. What it isn't is selling, dominating the discussion, explaining, asking, allowing the other person to steer the discussion and the agenda. Keep those things in mind as we continue to understand the best strategies. Salary negotiations. Honestly, this is the topic that I hear most, especially as we have robust demand in the locums sector for those that are within those types of markets, but also people competing and changing jobs according to increasing benefit for competitive compensation and benefits in other locations. When you are negotiating a salary, whether it's at a new job, existing job, or for another role, you want to use data to justify your salary negotiations. There are many different sources to be able to determine national benchmarks. We all know the national surveys, but there are other companies like Sullivan Cotter on top of MGMA, AMC that and others that you're able to use as valid data that is a conglomerate based on answers. You need to also emphasize how utilizing these data exceed your current pay band, and adjusting and right-sizing is absolutely necessary to remain competitive in our current environment as you continue to add the value that you do. You want to highlight how your skills and contributions align with market standards. This includes not just focusing on the intraoperative and surgical services perioperative period, but the other values that we add, from downstream values to call coverage that allows for types of levels of trauma and ACS accreditation, for airways, LPs, vascular access, intersectionality of interdisciplinary models between acute pain and consultations within the hospital. There are many different aspects of care that we touch that aren't always inside the OR. Justify your added value by showcasing skills and achievements beyond your current role. List additional responsibilities and tasks you've taken on since being hired when you're asking for a raise, and connect your added responsibility to market expectations and industry standards. One of the most interesting facets of our current market that I have learned in the last couple of years is that, as we would expect, the supply of anesthesiologists is not going to match the demand for anesthesia providers as a whole. Almost 30% of our current anesthesiologists are leaving practice by 2033. This leads to a shortage of about 12,500 anesthesiologists. 60% of a facility's revenue, as we discussed, is derived from surgical services, and being able to staff this becomes increasingly challenging as we're all taking anesthesia providers from the same pool. We have approximately 42,500 current active anesthesiologists, 56,000 active CRNAs, and there are many different considerations for the training program numbers impact. By 2030, the United States could see a shortage of up to 120,000 physicians as a whole. And when we consider the shortage that by 2033, 2033, that we will be experiencing in anesthesia, it really is important for us to have an evolving and more metered approach to having compensation review, not only for satisfaction, but as acuity increases, as ratios increase, and as we become in greater demand, this is important. So over 17% of current anesthesiologist pool are nearing retirement, with 56% being older than the age of 55. There are more than 7,700 people per one active anesthesiologist, so the gap between supply and demand is going to continue to grow in the anesthesiologist space. Now, there are only 172 anesthesiology residency programs with 1,600 positions offered nationally in the United States. Now, in 2023, 1,353 medical students sought an anesthesia residency and did not match. And this represented 46% of the applicants. This fact suggests there are just simply not enough residency positions available in anesthesiology. CRNAs represent more than 80% of anesthesia providers in certain types of communities, and they too are with a 24% acceptance rate that they're going to have doctoral degrees. They are not going to meet the demand for the different areas that they cover. Now, the employment growth of physicians and surgeons between 2021 and 31 is projected to increase by 3%, and within that percentage, 1.1% or 400 jobs will become available for anesthesia physicians. For a 10-year period, 400 jobs is not insignificant. Now, New York, New Jersey, and Illinois are the states with the highest published employment. When we look at the impact of revenue being 60%, when we want to overcome the anesthesia provider shortage, we have to consider the fact that improving OR utilization pressures, reduced cost, and expanding efficiencies have had an impact on what it feels like to practice anesthesia today. Work-life balance has honestly, in an impressive way, been a true priority of the newly graduating residents and fellows. And this has, I think, placed a different lens on what it means to be working in the anesthesia space. 47% of anesthesiologists reported last year of being burned out, and 54% attributed that to lack of control or autonomy in their life, and 44% said there were too many hours that they were working. Now, considering all of this, shifting the focus to create a supportive and flexible work environment is another facet for negotiations. There are many different facilities now that are cutting back to 8-hour shifts being, and 4 days a week being considered full-time. They're adjusting what call burdens are considered baseline. They're improving their ability to offer flexible terms for people that are entering. And so taking all of this into consideration, our market is going to become increasingly tight with less anesthesiologists to go around. The bonus, or really big benefit to this, is that means that we have greater negotiation power. The downside is we are still needing to cover an ever-increasing demand for our services. And so we have to balance that for our own wellness, truly. So as we were talking about hostage negotiations earlier, Here are some of the frameworks that you need to go through in order to have a successful negotiation. You want to establish rapport, frame questions with a no-based response, have active listening, mirroring, labeling, communicate clearly, set a deadline, and also leave a lasting impression. As I was going through the terms for becoming chief of pediatric anesthesia, one of the things that I said before I left my first discussion over the resources and terms that I'd asked for in my own strategic plan is that while there are other opportunities that exist for stepping into a division chief role for pediatric anesthesia, that having been committed to the institution I serve for the last decade and working respectfully with these individuals and with administration over that time, that my assumption is that I would receive the respectful consideration that was warranted for the magnitude of the role that I was being asked to fill, and that the terms would match, that I appreciated having respectful conversation, but the only way I would be able to be successful in this role was if I had the compensation and resources necessary to be successful. And this was the last thing that I said. Another example of being able to discuss specific facets of the jobs and roles that you have, and this is, again, using this leadership role as an example. I had asked for an executive assistant in order for us to serve the 20 to 30 people that we have in our group, in order to minimize the amount of administrative work that needs to occur so that we can focus on clinical productivity and taking care of patients. And when it was cited that I could really just apply to the hospital and see what happens, because that isn't something specifically they would be including in the negotiation strategy, I did respond with that. If that's the route that you'd like me to take, I'm more than happy to go through the process to request this resource, and then we can make the acceptance of this role contingent on the outcome of that request. Now, I didn't say that in a disrespectful manner. I was firm because of the necessity there, and the mutual benefit was clear. And so brushing off a need by deflecting is a strategy that is often used, but pretty much many of the different resources you may need are not off the table and are not outside of the realm of them being able to provide. So you need to hold them accountable to that because of what value you provide. When you establish rapport, you're setting the tone, you're using a calm voice but maintaining professional demeanor. You show empathy. You respond to things rather than react. Now, having a poker face isn't always the easiest thing to do, especially if you're somebody that wears your heart on your sleeve. But this is something that you need to prepare yourself for before you enter the negotiation room. Know your audience, the style, culture, breakdown. Ask getting no questions. Is now a bad time to talk? Is it a ridiculous idea that I would ask for these resources or for this salary? Are you against, or do you disagree that a sign-on bonus is appropriate, especially given the competing offers? Have you given up on the idea of a work-life balance that will allow for us to retain the employees that we have, the physicians in the group, because of the local, regional, and national attrition and movement that really does have a huge financial impact on the enterprise? When you actively listen, one of the most important parts of this is mirroring. When somebody describes to you the thoughts, the responses, active listening and mirroring is best demonstrated by repeating back what you heard. So as I was asking for support for some of the academic, teaching, research facets of our responsibilities and the qualities that as a faculty member in my own practice they desire, in addition to clinical responsibilities, which are always the priority, when I heard they didn't want to provide resources for anything but clinical, my response at that time was, what I'm hearing is You would like us to be a purely clinical practice, focus only on the clinical activities and exclude being able to provide any value in the academic space. If this is the case, I can restructure my strategic plan so that we can be a clinical focus. While that will mean that we are the only division that is not aligned with the institution's mission and vision and values, I'm perfectly willing to do that because we are unable to engage in these other facets of expectations without the support that we need. So what I am hearing is you don't actually want to support this. What I'm hearing is you have never offered this type of resource or increase in the past. What I'm hearing is you don't need any additional people in your group. There are many different ways to phrase this, but like I said earlier, remain non-emotional. As we're mirroring some of the things that we do when we engage with surgeons, as we say, you're concerned about a delay in starting the case. You don't expect any blood loss. Is that the reason that you don't feel that an art line or a type and screen or cross is needed? There are many different key ways to mirror in order for you to turn the response back on the person asking or responding to a discussion so that they need to solve the problem. When you label, utilizing the beginning of the response with, it seems like you aren't interested. It sounds like this isn't one of your values. It looks like, it feels like. If you're thinking, I don't want you to be upset about this, then label it. It seems like you're upset about this. So that makes the conversation change to them having to explain whether they are or are not. So use empathy and utilize the beginning of these sentences. Communicate clearly and use calibrated questions. What makes you ask that? Well, how would I go about that without that resource? Set a deadline. Otherwise, things get extended and drug on, and it honestly is respectful to you, and you go on the record for accountability. When you want to make a lasting impression, as I said earlier, you want that the last impression is a lasting impression. So make sure that it is a good one and an impressive one. Now, when we're engaging with administrators, prepare, discuss the anesthesiology supply state of the union. Looking at local versus national market benchmarking is an option. It's known in some markets that our national benchmarking and surveys have not yet caught up with the impacts of the post-pandemic era and what we're seeing for shortages after retirements, etc. Which factors aren't advantageous to prioritize in a discussion? This is something I want you to look up, but citing that inflation demands that you go up on salary is not actually part in business of changes in compensation. Utilizing inflation as a reason is not a productive way to approach it. There are other ways to have default increases but these are not typical unless they have been contractually present. I've seen most contracts shift away from that. Now, the other point that I want to hone in is ASA unit productivity considerations. Unless you're in one of those keep what you kill models in private practice, when you're covering call and you're providing other support services, there's only a fraction of your responsibilities that are in revenue generating timeframes or prime time. And so only utilizing your ASA unit productivity as a benchmark to whether you are at the 25th, 50th, 75th percentile really is not supported as the only focus. So being able to call into question that in order for somebody to have a level 2 trauma designation or ACS, or being able to provide the backup and resources when you are there on call, there is not guaranteed revenue generating activity. And therefore that's a pay for presence aspect of your role. And so you have to remove that time frame from the ASA unit if they're wanting to cite that time frame in order to abbreviate or factor in those time frames and value. When you want to investigate administrative interests for satisfactory outcomes, you want to look at operations productivity, how many locations and coverage you have, what other things you do in the hospital, your value per hour, location, day of the week, and cases versus minutes. A lot of times institutions, well, every year they do a calendar year budget, and they may increase based on their needs for cases and minutes independently in order to hold you accountable for an increase year over year. Typical is 3 to 5%, and it really depends on the environment that you're in. But a lot of institutions are extending beyond that. And if you don't reach your 7 and 8% increase in cases, which you don't control because you're not booking them, then they question whether that is a reason they can hold back on giving you increased compensation. And you need to be able to speak to that. Determine your priorities in the issue. Always ask for more than you may need, but also ask for everything you may need. That allows you to know what your deal breakers are. But if you don't ask, you don't receive. Always listen twice as long as you speak. This is something I've had to work hard on, but people will tell you things as you pause and listen, and filling silence is a cultural thing that we do here in the United States. It is a disadvantage in a negotiation. Understand what compensation terminology is accurate. There's total cash compensation that is looking at base pay, call pay, incentive pay that is available, although that is part of the variable components. And academic institutions, there could be pay for rank, and those are the parts of cash compensation. When you add direct compensation, you also have things like benefits, retirement, and other value-added facets to the job. So the key takeaways are there's no substitute for preparation. When you know you're going to enter a negotiation, have all of your considerations written down and practiced. Have rebuttals, respectful rebuttals, and questions that you may ask which they will, if they instantly dismiss some of the things that you're asking. Find the metric the business cares about and discuss how you will move it. We would like to we have surgeons on a wait list to get more time. They will be able to add cases that produces more revenue. And in order for us to do that, we need to have more staff. So that's increases in the amount of staff that you need. Honestly, I don't know that that's part of the conversation anymore. I don't know any fully staffed institutions right now. But in order for you to be able to stretch and cover, if you're asking people to do more, there needs to be value added to that. And the only way you can do that is if you match the metric that they care about. Avoid fairness references, avoid emotions. That halts effective negotiations. Start with a no question. Do you have a policy against offering a sign-on bonus? Especially if you've done your due diligence and you know that it has been given. Actively listen, hear, then repeat back with mirroring technique. Ask about mutual goals. Convert your value into solving a problem for them. I'm just here to be able to provide you a service so that you can increase your overall cases and minutes because we have more staffing, or staffing willing to cover more because of the value added. Because as you ask people to do more, you are asking them to give up their own free time, and it needs to have a commensurate value and compensation for that. And then show gratitude and authentic humility as the last impression. Thank you so very much for being part of this mid-year conference. I'm at Children's Nebraska and University of Nebraska Medical Center. I can be found at jessica.goeller@unmc.edu, and I'm always happy for you to reach out and ask any questions.